Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Every year, over 600,000 people die as a result of cardiovascular disease. It is called the #1 killer. Why is it that worldwide over 17 million people die from heart disease? How do we stop this disease? Do you have heart disease, or do you know anyone with heart disease? Do you know if you're at risk for heart disease? Do you have diabetes, hypertension? Do you smoke? Are you overweight? Or do you sit a lot? If you answer yes to any of these, it means that you probably are at risk for heart disease. So in our show today, we will be discussing cardiovascular disease. We will look at the symptoms, we'll look at the risk factors, we will look at the diagnosis and the treatment. And most importantly, we will discuss how you can prevent yourself from dying from this disease. On our show today, we're going to have a guest speaker, board certified in cardiology, and he will come and explain the reason for so many deaths and how you can protect yourself from heart disease. So don't go away, I'll be right back.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935. Dr. Donna Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonnacooper.com.
Welcome back to Get Healthy with Dr. Cooper. Today our topic is cardiovascular disease, the #1 killer in the world and in the United States. However, you really don't have to die from this disease. I have a special guest in my studio today. He's board certified in heart disease as well as obesity. Dr. Pedro Mego. Doctor, welcome to Get Healthy with Dr. Cooper.
Thank you, Donna. Thank you for having me here.
My pleasure, Pedro. Can you tell us a little bit about yourself?
Sure. I am originally from Peru. I did medical school at San Marcos University, and then I trained internal medicine in New York and cardiology and interventional cardiology in Arkansas.
Very good.
Before coming and practice here in South Texas.
How long have you been here in South Texas?
Incredible, since 2005.
Wow, that's a long time. I came here in 96, so I beat you to that. Doctor, I know you have a very busy practice, right? Cardiovascular disease. Why is it so busy here in South Texas?
Yeah, we have been blessed. We have a very busy practice. Probably like most of our people knows, is South Texas and McAllen has been found to be the city, one of the most city with most obesity in the world, and that increased risk for metabolic syndrome, diabetes, and that increased risk for coronary artery disease, and probably that is one of the, and providing good service to our patients, that is in combination with that, we have a very busy practice.
I like the last one, providing good services to your patient.
Absolutely.
You're smart. All right, doctor, heart disease. Tell me a little bit, what is coronary artery disease really?
Coronary artery disease is called ischemic heart disease. Like probably we know the body has the heart as a pump. This, the main function of the heart is to pump the blood from the heart to the body, but the pump per se, the heart per se has their own circulation. When these arteries to the heart get obstructed, it's called coronary artery disease. And unfortunately, this is significantly common, and unfortunately, this is the #1 cause of death in America, in the whole world.
That's right.
Unfortunately, and probably we're going to talk a little more about that, is the prevalence in South Texas is very high.
Right. So what are the risk factors? You said the prevalence is high here. Why is this so?
It is well known that diabetes, hyperlipidemia, hypertension, smoking, age, family risk,
Right.
sedentary lifestyle, obesity, renal disease has significant impact as a risk factors for coronary artery disease. And unfortunately, all of these risk factors are very high here.
That's right. So our listeners that are probably watching us, they might be wondering, do I have heart disease? What are some of the symptoms, doctor?
The most common symptom, the symptoms depends on the stage of the disease. If it is an early stage, we are asymptomatic.
Right.
However, if the symptoms are present, means that person most likely has already moderate disease or even advanced disease. The main common symptoms are chest pain, especially related to exercise. If somebody could walk 5 blocks before and now hardly can walk a block or 2 blocks, and this is, I mean, they stop because of chest pain. In the way, that is a very strong alert that they could have coronary artery disease. Shortness of breath, reduction in functional capacity are the other symptoms related to this.
So doctors like myself, internal medicine doctors, family practitioner, we send our patients to you. When you get to our patient, what do you do with our patients? How do you make the diagnosis?
Basically, we evaluate the patient, the risk factors, the symptoms, and if we find that they have significant risk factors and symptoms, we evaluate it with a stress test. That's the most common test, how we evaluate it. If the patient can walk and run, we make them walk and run fast as a protocol. If they cannot, we do a chemical induced exercise. It's called a nuclear stress test, basically, if they are not able to walk fast enough or we estimate that they cannot walk fast enough. That will give us, if abnormal, will increase significantly the chances that they have coronary artery disease. Other tests could be exercise or chemical induced with echocardiogram, or another one could be a CT scan, what is a CTA, a coronary CTA, with calcium scoring as well, can give us a close estimate of the coronary circulation.
But the definitive diagnosis is made by your left heart cath, right?
Basically, the gold standard.
The gold standard.
The gold standard for coronary artery disease is made with
So you brought us some pictures. We're going to walk over here. We're going to look at the normal coronary, and then we're going to look at the abnormal ones. So we want our producer to put on the normal coronary, right? Because a lot of patients get scared. They say, oh, I need to go to the cath lab. And they get scared. Should they be afraid of the heart cath?
I don't think so. Coronary artery disease per se is a low-risk procedure. No? It's a procedure that has less than 1% complication risk. Majority of the doctors do it from the groin. I usually do it from the wrist. And with that, I can get access to the arterial system, advance the catheters to the heart, and inject some iodine contrast. And with that, I can visualize the coronary circulation.
All right.
And according to what we find, it depends what we are going to do.
All right, so let's put on our video for the normal cath so that our audience can see what the normal looks like and what the doctor does to relieve the stenosis. All right, so we're going to get it. There it is, doctor. It's right behind you.
Basically, this is almost normal because we rarely doing a normal patient, but some patients, even having what we call abnormal stress test, the coronary arteries are not that bad.
That's right.
No? For example, this is the right coronary artery. There is a little lesion here if you go in detail comparing to the normal side. In the heart, there are main three arteries. No, two coming from the left main, the bifurcation, the left circumflex, and the left anterior descending artery in the front of the heart. And the one that we saw initially was the right coronary artery. Basically, this has minimal obstruction, only mild irregularities. For this patient, is good news. Only we need to continue controlling cholesterol, diabetes, hypertension, antiplatelet therapy, but we don't have to do any intervention for him.
And lifestyle.
Lifestyle, very important.
Right.
Very important. Treat overweight, treat obesity, increase physical activities progressively as much as tolerated.
And the diet is important.
Like probably you have mentioned strongly enough, our diet is the #1 cause of our overweight and obesity.
There you go.
And we need to work on that.
Very good. Let's move to the next one. I think the doctor has some more.
Both of these cases has been done this week. If you have one before this, I think, in this one, for example, this is the left anterior descending, and here, this artery should continue all the way here. But you can see it's obstructed.
Yes.
No, and this actually is my wire that I am trying to cross this area of 100% occlusion.
Right.
If you can go to the next one.
Go to the next one.
I think this is the original one. You can see it. This artery, it gets obstructed here 100%.
Yeah, you're losing it there.
Here, you don't see it anymore, and this artery should continue there. This is my wire that now is in the apex, in the distal part of the heart. Now I put a balloon, and this is when I am inflating a stent, where is a small metallic piece that keeps the artery open. In the past, we used to do only balloon angioplasty, then we did just with metallic, but now we have a medicated stent. No? Like you can see this stent here, and now the artery goes all the way to the apex.
So you opened this.
I opened that artery.
Fantastic.
Yeah. And this is a patient, for example, that came to the hospital with chest pain, shortness of breath. Actually, we already knew that this one, another cardiologist did it and was obstructed in 2015.
Wow.
And I mean, with experience and some techniques, we are able to open these arteries, even if they were obstructed 100%.
Wow.
He was considered a poor candidate for bypass at that time, and they said with medication, but he was not doing good with medications, chest pain, shortness. In this patient, he's doing fantastic. He's benefit. He has already noticing benefit the day after.
That's right, because now we have the blood flow getting from the origin down to the muscles, because you opened up so the flow can get there. So his pain should have improved.
He was very surprised when the next morning he could walk outside the room with no chest pain, no shortness of breath, something that he didn't experience for years.
Good, Doc. And I hope you counseled him on lifestyle.
Very important, like no more emphasis. I will never get tired to emphasize the importance of improving our diet. Like probably we know 80 to 90% of the problem with obesity is not a lack of exercise, it's our diet.
That's right.
And we need to improve that even more than doing exercise. Improving our diet is the main factor to have a better weight.
That's right. Studies have shown that the #1 risk factor for chronic diseases, diabetes, obesity, heart disease, and cancer, it's the food you consume. So doctor has just showed you how he treats coronary artery disease. However, if you have heart disease, and even though you have a stent or a bypass, but if you continue to live the same lifestyle, you're still overweight, the blood sugar is not controlled, the blood pressure is not controlled, you're eating a lot of fat, a lot of fried foods, you're going to block up the coronaries again. So you have to ensure that you take good care of yourself. Doctor, is there any last minute word you want to say to the viewers?
There is no, it is very important that at a certain time in your life you need to put emphasis in your health. And this time, the best time to do it is now.
That's right.
Not yesterday, not tomorrow. Let's do it now. You didn't do it yesterday, do it now. And emphasizing, trying to do a healthier lifestyle, improve your diet, try to get into an exercise program, and consult your family doctor. No? And if your family doctor recommends you to be seen by a cardiologist, follow that advice. And here in South Texas, we would love to take care of you.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonnacooper.com today.
I think we have Adrienne out on the road with some questions for you, doctor. So we're going to go to Adrienne and some questions. Let's see what he has. They're going to come right on the screen.
Hi, Dr. Cooper. Today I'm here with
Angel Guerra.
and he has a question for you.
My question is, can I get high blood pressure as a young person?
Doctor, you want to answer that?
Yeah, unfortunately, the answer is yes. And we are seeing significant chronic diseases at much earlier age than before. For example, in 1990, diabetes in teenagers did not exist.
That's right.
And now, because of the obesity epidemic that we are living in the United States, now we see it very frequently even in kids.
That's right.
Same thing happened with hypertension. Hypertension used to be a disease of elderly, no? What we call primary hypertension, but now we can see it at younger age also because of obesity. There is, that is like the primary hypertension. That is also called secondary hypertension, and anyone who is younger than 40 should be evaluated, with hypertension should be evaluated for renal artery stenosis, or that basically means
Not enough blood getting to the kidneys.
and the kidneys are producing a hormone that increases the blood pressure. No? Anyone who is, has 3 medications and has no well control, anyone who has worsening in the last 6 months, or anyone younger than 40 years old should be evaluated for renal artery stenosis.
Very good. Let's take one more question from Adrian. Let's see what he has for us.
Hi, Dr. Cooper. Once again, I'm here with
Aaliyah Juarez, and are overweight people at a higher risk of having heart disease?
Overweight people, are they at higher risk of heart disease?
Unfortunately, yes. Something also called metabolic syndrome. What is metabolic syndrome? Basically is the group of factors that per se does not diagnose diabetes, hypertension, or hyperlipidemia per se, but when you combine it, even having not at the risk to be diagnosed in neither of these diseases, increase already your risk for coronary artery disease. In that way, overweight and obesity is one of them. No? In that way, yes, unfortunately, obesity can increase your risk of heart disease significantly.
That's right. Well, doctor, it has been a pleasure having you. Thank you so much. And you stay right there. Don't go away. We'll be right back with more on cardiovascular disease.
Dr. Donna Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonnacooper.com.
Welcome back to Get Health with Dr. Cooper. We are in the kitchen segment. This is the chef segment, actually. Chef Edgar, welcome.
Hey everybody, how y'all doing? Welcome to the kitchen. Another exciting portion that we have for you all.
Are we cooking today?
Today we are going to talk about different foods and different substitutes that you could do to your diet.
Healthy swap.
Yeah.
You're probably wondering, why does she have meat and fish in her studio? Why do we have meat and fish?
We do not cook it, but
we're going to show you the difference. We're going to show you why it might be better to go plant-based. Now we have beef, we have healthy-looking chicken breast, and we have the well-known, well-loved salmon.
Salmon, yeah.
Right. Now, a lot of people believe that you have to eat all this to have all the protein you need, and if you go plant-based, you have no protein. Well, we're going to show you the dangers right now. Now, chef, tell me a little bit about this beef here.
This beef right here, we chose it because it's called the healthy cut, right? We see the nice marbling. People say you get so much protein out of this. but they don't tell you the cholesterol and the calories that come with it as well.
That's right. Now, for me, I don't eat this. However, 4 ounces of this here, this beef, will give only 29 grams of protein. But guess what? How much calorie does it have? How much cholesterol?
There's 105 milligrams of cholesterol in just 4 ounces.
There you go.
Just 4 ounces.
That's a lot. And remember, we're discussing heart disease here. And heart disease, you want to stay away from the cholesterol because it will block the vessels to the heart. Now, Chef, this looks good. I don't see any fat.
Right, there's no fat. All the fat has been trimmed off. This is the chicken breast, the healthy part. But, again, calories, cholesterol come with this as well.
Right. How much cholesterol we have here?
Here we have 65 milligrams of cholesterol in a grilled chicken, which is the healthy cooking chicken.
That's right. So if you were to put the leg and all the skin,
All the fatty part of the chicken,
goodness, that's a lot of cholesterol.
it's a lot of cholesterol.
And believe me, you're only getting 23 to 25 grams of protein, not a lot. And Chef, a lot of people are going to fish.
Right.
Okay? Now let's talk a little bit about the fish. Now you know that with this is a high content of mercury probably, and mercury is dangerous for your health. That can cause Alzheimer's. But Chef, how much cholesterol do we have in this nice looking salmon here?
There's 45 milligrams of cholesterol in salmon. And this is a salmon that everybody says it's healthy, it's nice for you, but salmon is one of the fattiest fish there is out there.
That's right, and that's only 4 ounces.
Only 4 ounces or less.
Right, and the protein content is about 23 to 25 grams. Can you imagine that? Let's look at our healthy swap. Now, this is chickpea. How much cholesterol is in this?
This, 0.
0 cholesterol. But then we have 39 grams of protein in 1 cup.
Yep.
And then we have black beans. This is filled with protein.
A lot of protein.
1 cup will give 39 grams and 0 cholesterol. All right, lentil is the same. So guys, here you go. We have our beef, lots of cholesterol,
A lot of cholesterol.
some protein.
So much.
This one,
A lot of cholesterol, a lot of calories. Oh, you want to stay away from that.
right. So I know it's difficult to change altogether, but remember, your health is most important. So if you want to live a happy and healthy lifestyle, then go plant-based.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonnacooper.com today. Dr. Donna Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonnacooper.com.
Welcome to Get Healthy with Dr. Cooper. Do you have diabetes and want to get rid of it, or high blood pressure and want to improve your blood pressure? Then we have something special for you. Active living 30 minutes a day or 60 minutes a day will cure your diseases. Ramsey, what do you have for us today?
Hello, Dr. Cooper. You're right. I like that explanation. What we have today is just going to be an exercise with resistant bands, going to focus on the lower body. We have our beautiful ladies here just to show us. We're really going to focus on the front squat right here. We're going to use a little bit more abdominal muscle to sustain us. Here, we're going to have the girls bring the resistant bands all the way up, drop all the way down. Let's go. We're going to get a good 5 in. Here, we really want to focus on bringing that butt as low as possible and keeping that back straight. Keep that back straight. Don't try to lean too much, especially with this exercise. We do have the instance to lean a little bit more, but just try to sustain yourself and go as low as possible. For some of us, we can't go that low, so again, push yourself to go as low as possible. We're gonna go at least 15 to 20, 4 sets. 4 sets total, 15 to 20. Now the next one, we're gonna do a straight leg deadlift. Straight leg deadlift with resistant bands. We're not using any weight in this. All we're doing is going down as low as possible, keeping the legs straight, coming up. Not everybody has the same flexibility, so try to push yourself as much as you can. It's not easy, but try your best. Again, we're gonna go 15 to 20, 3 to 4 sets, 3 to 4 sets, depending on how you can. It also depends on the economy of what you can do. Just try to push yourself as much as you can, okay? Now what we got is a single leg kickback. Just bring it back. Same thing, if you feel comfortable with your hands on your hips, do it with your hands on your hips. If you feel comfortable with your hands up in front of you, do the same thing. There you go. Here, 15 to 20, we're just trying to get that muscle conditioning back into play. We're just trying to get our muscles back under us. 15 to 20, 3 to 4 sets. There you go. And don't forget, we got both legs, 15 to 20. And that's our segment for today. Dr. Cooper, thank you for having me. This was quite an experience.
Thank you, Ramsey. Thank you. I notice they need a lot of balance for this exercise, right?
Yes.
So,
a lot of core.
there you go. You out there, if you have difficulty balancing, just go slow. And remember, if you want to live a long and healthy life, you must move. Exercise is important for good health. We'll be right back. Don't go away.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
Welcome back to Get Healthy with Dr. Cooper. Today you've learned that cardiovascular disease is the #1 killer. But there is hope. If you are diabetic, if you have high blood pressure, if you walk and you have chest pain, if you're overweight, then probably you're at risk for heart disease. But there is hope. Remember that the #1 killer for any disease really is the food you eat. So start today by cutting back on food with too much cholesterol, animal products, red meat, cheese, oils, and start increasing plants, fruits and vegetable nuts and seeds in your diet, and you will be on your way to good health. I do know that it's not easy to change lifestyle, but remember there is hope. Our Heavenly Father wants to help us. And in Philippians 4:13 it says, I can do all things through Christ who strengthens me. So don't hesitate to call upon Him for help. I'll see you next week. Until then, may the Lord bless you richly.